So the field of angiogenesis became, let's say, important when let's say, by the end of the last century, it was suggested that if you have a tool to inhibit angiogenesis, you have a tool actually to control tumor growth. And that was shown very initially by a couple of groups and compounds that it is possible. But then, as the field progressed, it was actually not working as well as what people understood or what people expected. So then a lot of groups stopped with just developing angiogenesis inhibitors because they were not doing what everybody was expecting. On the other hand, there are maybe 10 or 15 drugs in the clinic already now approved by FDA that are working based on inhibition of angiogenesis. So it is very well introduced in the daily clinical management of cancer at this moment. But if you look at how efficient they are, I think you can say 2 or 3 months prolongation of survival. So that's not a lot. So therefore, the field of angiogenesis declined in time as probably as of, I would say, till as of 2010. And it is only a couple of years ago that people now realize that if you combine an angiogenesis inhibitor and you give simultaneously an immunotherapy, that there is a fantastic synergy between the two. And that is now what we have. So I think that there is a revival of the field of angiogenesis based on the fact that there is this fantastic synergy between inhibition of angiogenesis and immunotherapy, and then immunotherapy mainly checkpoint inhibition. So that means that there is now an enormous interest in angiogenesis inhibitors again. And so my group has never ceased in doing this aim in finding new angiogenesis inhibitors. And we have, some 10 years ago, we have decided to develop angiogenesis inhibitors by making vaccines. So at this moment, I am developing vaccines for the inhibition of angiogenesis. And well, in fact, that is also already an immunotherapy in itself. So, and I think that that is the reason that these inhibitors that we developed was actually just a vaccine work so well. So now we have a couple of vaccines tested to be very efficient in taking care of tumor growth in mice. And for that reason, we started also a company. Company is called SimCure. And this company now has one lead product that has been tested in mice as well as in a clinical study in dogs. And well, the result of that clinical study is actually fantastic because we doubled the overall survival of dogs with bladder cancer in this case. And well, the interesting thing of the field is that the way we are doing it is actually independent of tumor type. So in dogs, we have done clinical studies now also in osteosarcoma and in prostate cancer and in hemangiosarcoma, and they're all positive. So we are now busy trying to develop our vaccine for testing in humans. And well, we are now working. Actually, the formal tox study was done in China by a company called Wuxi. You might know it. And that means that we are now awaiting the first patient planned for somewhere this summer to be treated with our vaccine now. So that is what we are working on now. Angiogenesis is still a hot topic when you aim for improving immunotherapy. So that is what we are doing now. So, and that's what my lab is doing. And I think that, well, there is quite some interest in the work that we are doing. Yes. So actually, this is an extension of what I just said, that angiogenesis inhibition is there to improve immunotherapy. And then very many immunotherapies nowadays are checkpoint inhibition strategies. But another very promising way of immunotherapy is the use of CAR T cells. And CAR T cells, well, they are regular normal T cells that have been changed in the way that there is now an kind of T cell receptor that is made up of an antibody. And it has a very nice advantage for because it's independent of MHC, so HLA subtypes. So it is very interesting immunotherapy. And our hypothesis was, if we improve immunotherapy by angiogenesis inhibition, then we should also improve CAR T cell therapy by just combining it with our vaccine, for example, or with any other angiogenesis inhibitor. And so that means that we have now been supplied by the European Union with a large grant to test this hypothesis. And actually, we're still busy with that. So we are developing now. So we are collaborating with a group in Switzerland where they have this mouse model where they can treat glioblastoma with CAR T cells. And that's published already by that group. And we are now in the process of showing that the combination with our anti-angiogenic vaccine is synergistic with this CAR T cell therapy. So that is it's very exciting. I cannot show data yet because we're still in the works. But the paper that we published on this is actually it's a review on the background why we think that CAR T cell therapy is in need of angiogenesis inhibition. So that's actually one of the it's actually a straight extension of the whole strategy of my lab. So we want to combine immunotherapy with anti-angiogenesis. That's actually the main message of my lab. That's still let's say it's in the works. We don't know that yet, but considering the fact that CAR T cell is by itself a fantastic strategy, however, it is mainly a fantastic strategy in hematological cancers. And so for leukemia and lymphoma, it's amazing. But if you try CAR T cell therapy for solid tumors, let's say breast cancer or colorectal cancer, it's much more difficult. And CAR T cell therapy actually, there's a major challenge in getting CAR T cells active in inhibiting solid tumors. And probably, this is also what we think, probably that is because of the fact that it is very difficult for white blood cells and therefore also CAR T cells to enter the tumor parenchyma. And so it's very difficult for a leukocyte to enter the tumor. And that is obviously something that is necessary. Otherwise, the T cell can never kill the tumor cell. And this is exactly what my hypothesis is. If we combine the therapy with the vaccination that we do, then probably it is much more easy for an leukocyte to go out of the blood vessel into the tumor. So intratumoral or let's say extravasation of white blood cells into the tumor is made, let's say, easier with an angiogenesis inhibitor. So that is actually, so if my hypothesis is right, then I think it is extremely promising for the treatment of solid cancers, all solid cancers. And so, 93% of all cancers are solid tumors. And leukemia lymphoma is actually only 7%. So that means that there is an opportunity for 93% of all cancers, which is 100% of all solid tumors. So, well, I think that that is quite promising. Even if we improve the therapy by only a few percent, but you do it for all solid cancers, that is a major advance. So this is, I have my hopes up, let's say. Yes, actually, my major motto in life is stick to your goals. And actually stick to your goals and never give up. So my message to young scholars is exactly that. And if you want to, so actually that's what I did in the field of angiogenesis when the interest was declining. It would have been very easy for me to say, okay, nobody's interested, I'll stop. But I'm super happy that I didn't stop because actually this is now leading to this promising effect of the dual therapy. So if you want to investigate something, of course, I understand you have to get a job somewhere and do it, and then probably also receive the money for it. But if you really want to do it, you will be able to do it. The money will come for it. So
And
that's my major message for young investigators because sometimes it is not easy to develop a career in science. It's very dependent on money, and there's a large competition of other people. But I'm convinced that if you feel that you can do research and you want to cure cancer or anything else, if you want to work in cardiovascular disease or in whatever disease, it will be possible. Just stick to your goals. I think that a major field next to angiogenesis is still a small field, but a major field is just immunology. I think that immunology will be the field where the biggest advantages will be found. So as a journal, I would focus on these focus fields like immunology. And for me, I would say in the combination of angiogenesis and immunology. But I think that, sorry, I'm recovering from a cold that I had last week. Um, so some groups are still working on chemotherapy. Now, everybody is super happy that chemotherapy exists, but it is also known that it is a horrible treatment and improvements will probably not come anymore. I think it is overdeveloped field. So I would say if it is only chemotherapy, that is not the way to go for the future. But maybe combination therapies with chemotherapy, that might be very interesting. So in general, actually, combination therapy is the way forward.